Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey. Today, we're back for part 2 of our New Beauty Awards series, where we are featuring the winners that we offer here at La Jolla Cosmetic. And there's a lot of them. So we've cut it up into 3 parts. And today, we're talking about injectables and prescription products. So there's so many things that are like super exciting on this list. And so today, to talk about the injectables is our wonderful nurse injector, Jennifer Franz. Welcome back to the podcast, Jennifer.
Hi, thank you. I'm glad to be back.
Yeah, it's great. So winning the award for best neurotoxin for forehead lines, I'm going to give everybody 3 guesses as to who won. So tell us the winner. Drum roll.
Botox. Right.
Botox, yeah.
Botox, the tried and true, the one that's been around the longest, the one that probably everyone has tried if you've ever tried a neurotoxin.
Yeah. And I think probably, would you say like 80% of people use, I mean, if you're using a neurotoxin, is that kind of how it breaks out with Botox?
I would say so. Yeah, I would say it's predominantly Botox still to this day. Dysport would be second, even though it's a great product. It's just, not as widely used in the United States. And then we have Xeomin, which came out a couple years after, well, I shouldn't say a couple years, quite a while after Botox and Dysport. And then the most recent one, Jeuveau, has been around for quite a long 3 years now?
3 years. Yeah, I think they launched like right before COVID started.
I think that's about right.
Yeah, so
that's about right.
And so then, Botox, we have, one thing great about Botox is I think, at least from a consumer point of view, it's really predictable. Like I feel like you almost always consistently get a good result.
Yeah, I would agree. In the right hands, of course, you do tend to get a very consistent, very predictable result with Botox. There's different ways of dilution techniques. There's different placements, obviously, but it's as a practitioner, I feel like it's very predictable.
And so, it's sort of that household name that everybody knows. It's like Kleenex, right? That nobody says soft tissue. They say Kleenex. So it's like Botox. But, it got the award specifically for forehead lines. And so how often do you see people using Botox? How often? Many times a year. And then where else would they maybe use it?
Okay. Yeah. So Botox in most cases is something that needs to be repeated about 3 times a year. So it lasts up to 4 months. In my long practice, it's very standard that my patients come in every 3 to 4 months. And they're consistently staying on top of their treatments. And some people want it the second they start seeing a little bit of that movement return, but in most cases, if you're staying on that every 3 to 4 month routine, you get a really nice, consistent result over time. Forehead lines is just one area that can be treated with Botox. The first FDA approval was glabella, or those 11s, the lines between the brows. That's probably the most common area. Forehead lines would be next for sure. That came along soon after that. And it's these horizontal lines that you get when you raise your eyebrows. And it's that raising of the eyebrows that makes those lines. The more you raise your eyebrows, the deeper those lines become over time. Of course, everybody's skin type is different, but it's a very nice treatment result when everything just looks nice and smooth. I think it's that kind of glassy forehead that a lot of people really like.
Right before the show started, I'm like, Jennifer, it's getting to be time. But and one of the things that I think everybody really needs to know, I can't remember how many areas it's FDA approved for now, like 6 or 7 different areas. Do you remember?
3. 3 in the upper face. Yeah. Okay. So glabella, forehead lines, frontalis, which is frontalis, and then crow's feet or around the eyes. That was the 3rd area. That's a good question as far as FDA approvals go.
Right. But then as far as like typical treatment areas that people might add on and what you and I did. So you did for me, which I'd never had before, is the, what do you call the platysmal bands?
Platysmal bands.
So that's kind of that neck, the neck
that kind of
cords.
pop out right through here. Yeah, those muscles can be nicely treated with Botox. These are all off-label areas. You can treat this muscle right through here, this little depressor muscle that kind of pulls the corners of your mouth. Chin
for the people who aren't watching on YouTube.
Right. That's right. It's the corners of the mouth, that muscle that pulls those down. You can put it in the chin muscle, which helps to just smooth like a cottage cheese kind of chin, people call it, or that like orange skin dimpling.
Orange peel. Yeah.
Orange peel. Yeah. The top of the lip can give a little lip flip for a lot of people who are maybe considering filler, but aren't quite sure if they want to go there yet. A little Botox can be put along that upper lip ridge and create a little bit of a flip, looking like more volume to the lip. It can also be nice for smokers' lines. Gummy smiles can also be treated with Botox in a very specific muscle. Jaw muscle masseters. So for people that have jaw clenching, migraine headaches, it's a very nice injection treatment along that muscle to weaken those muscles a little bit.
And you have a lot of experience with that, right? Tell us about you can just like throw it in and tell us what you've done with Botox, sort of in a less cosmetic way.
Yeah, I've loved doing that over the years. It's just kind of a fun little change up when you get to see someone who has migraine headaches. Not that it's fun for them, obviously, but it's fun to be able to help them to provide Botox for migraine headaches. It can be so life-changing. Facial tics or movements that are muscle related can be treated with Botox. And then you get into the whole hyperhidrosis, the excessive sweating thing in the underarms. That's something that I've done too in the past. It's a treatment option for underarm sweat, excessive sweating. So yeah, there are a couple things you can do with Botox.
A lot of things. I love it. It's like aspirin, it's like a wonder drug.
It is. It's probably, I think it's one of the most studied medications on the market because it can be so widely used for not only cosmetic reasons, but so many medical reasons as well, things that I haven't even mentioned. But
neat.
It's a widely used drug.
Good. Well, so now we're going to move into the next injectable winner from New Beauty. Yes. The winner in the cheek filler category is a variation of a filler in the Restylane family of injectables, and it's called Restylane Contour. So tell us about how this particular filler fills the cheeks maybe better than other fillers.
Okay. It's just a little bit different. All the fillers are different. They're all so much alike, but they're all different. It's kind of a strange little fine line between each one of them. But Restylane has its own group of fillers. Juvederm has its own group of fillers. And then each filler within that grouping does something a little bit different. It really just depends on where you want to put a filler, where you're looking for volume replacement. So each each filler's ingredients are the same, just the amounts of those ingredients vary a little bit. So Contour has what's called express technology. It's Restylane's newest family of Restylane products. That is a very flexible filler. It has natural movement. It is known for just allowing your face to have its normal expression. So hence express technology. So for Contour, So for Contour, what we're trying to do is, yes, replace some volume, but we can also just make the prettiest rounded contoured cheek with this product. So we may inject it just a little bit differently than we would maybe a different cheek filler. But the technique is similar. It's not that different, but it's all about the placement and getting this very nice rounded cheek that still has very, very nice natural movement and this beautiful contour.
Well, and I think that maybe sometimes when we see people who maybe have too much filler in their cheeks, do you think is it the fact there's too much, or is it the fact that it's not naturally moving with their face?
It can be both. Obviously, product choice is very important, and you hope that your injector knows a lot about different types of fillers so that they're choosing the right one for each patient. Because I don't think there should be any cookie cutter treatments out there. Not everybody's face has the same aging response or the same changes or needs the same amount of volume replacement. You know, sometimes you have to remember what the patient looked like when they were young, and you don't necessarily want to give them these giant cheeks if that's just not what their face should have. So you kind of have to look at this whole picture. But yeah, too much filler can simply just be too much filler, or it can be improperly placed, or the wrong filler could be chosen as well. So, you know, it really varies based on someone who needs that volume replacement, someone who's maybe my age and is losing volume over time and needs to have that volume replaced. Or if we're talking about perhaps a 25 or 30-year-old who just wants to have an enhanced contour for makeup reasons or photography reasons. So there's different ways, you know, you really have to look at someone's face and figure out what that person needs.
And how long would the Restylane Contour filler last for most people? I know everybody's a little different, but
everyone's different, and it depends on how much we're injecting. You know, if your injector recommends 2 syringes, but someone chooses to just do 1, for instance, which is fine. Sometimes we do these things in stages, and that works well too, but it may take a little bit to build up to that ideal result. So, you know, I'd say if you're doing a true fill to the proper amount of product, in most cases, you're going to get a good year out of it. So that's the indication, I think, is for a year. But some people might not see quite that long. Some people might feel like it lasts longer too.
Okay. So another winner from the Restylane family, and it's in the category of best filler for fuller lips, is Restylane Kysse, and it's Kysse.
Right.
So Kysse. So what causes thin lips, and how does Kysse kind of maybe differ or stand out from some of the other injectables in making a good lip?
Right. I love this product in the lips. I think, again, well, backing up, not that I think, it is, again, this express technology from Restylane that allows your lips to be volumized, but yet in the most flexible movement type of way, so that you can still kiss, you can still talk, you can still move your mouth very, very naturally. And that's what I love about it. I think some of the older generations of hyaluronic acid fillers created a very stiff look to the lip, a very filled lip, kind of firm looking. And personally, I prefer a look that's more flexible, more natural. It maintains the pretty shape. It adds kind of a plump, pillowy kind of look. So that's why I love that filler. What causes thin lips usually is just heredity. You know, it's just, you're kind of just born with what you get is what you get. And if you're blessed with a fullness in the lips, some people still want more fullness. If you're blessed with thin lips, some people just want to change that. So what fillers do is they really just enhance what you have. You know, over time, slowly adding filler can create a different look to the lips for sure. And the goal is to do it slowly and you know, make that change as natural looking as possible, in my opinion.
And if you see some people walking around where you're like, why does it look like the duck lips? Or like there's a shelf, like a whole shelf on their upper lip. Is it that the wrong product has been used? Or the wrong technique or
Usually,
both?
yeah, I think, more than it can be product. If the wrong product is used, it can be too heavy or too thick of a filler that's just too volumizing perhaps. But in most cases, it's placement and maybe also adding too much into that lip too quickly. You don't want to overstretch the lip because obviously there's only so much room, so much lip that you can fill. And you can change that slowly over time. If you're gradually adding filler, your lip is going to stay more natural looking. Its natural shape will maintain. But if you're putting a lot of filler in a small space very, very quick, then sometimes that filler will migrate, which is kind of the term of the year. Migration is when you're oftentimes seeing that filler extend up here above the lip or down below the lips. And then it looks unnatural and you lose that nice definition of those lip borders. And so approaching your filling technique with some grace and some time will oftentimes prevent that.
Now, I've heard a lot of people talking about reversing their filler.
Yeah.
And tell us a little bit about instances where you might dissolve the filler that the person already has.
Yeah. I've seen patients come to me over the years who have maybe had too much filler too fast, like I was just mentioning, and they do get that migration, again, into these areas around the lips. That's probably the most common thing that we see in terms of patients wanting their filler reversed or dissolved. So there is an ingredient that is just a little enzyme that dissolves hyaluronic acid fillers. So Restylane fillers, Juvederm fillers, these are all hyaluronic acid fillers. The nice thing about using these is that they are reversible. Hyaluronidase is the name of the enzyme, and it can be injected into that filler directly, whether it's around the lips, whether it's cheeks, wherever we want to try to eliminate that fullness or that response that someone got from filler. We just inject that hyaluronidase enzyme into that filler and it slowly dissolves it. Or quickly. And sometimes it's quick.
Sometimes the goal to get them back to the baselines and then figure out what you want to do next.
Right.
And how long does it take for that to do its magic?
It just kind of depends. I mean, sometimes I see almost an instantaneous result with hyaluronidase. Sometimes it's kind of a bit of a process where, especially if it's a patient that I didn't inject initially with the filler, I don't know exactly maybe what filler was used or exactly how much was used, where it was placed. So, I can make my best educated guess and do one appointment dissolving, and then I bring them back typically 2 weeks later, and we just check up and maybe need to touch it up and do a little bit again. Sometimes it's great after one treatment, but yeah, the goal then in most cases is to get back to a baseline, and then we decide, do we want to add filler again, just differently or better, or to try to achieve whatever result we were really going for.
And the last question on this about fillers in the lips, if somebody's never had their lips done before and they're pretty hesitant, but they would like a fuller lip, what advice do you give them?
Yeah. Well, I think it's important to come in and actually talk to one of us who do lips all the time. And we do have techniques that can help make a patient so much more comfortable. I think, sometimes people hear from their best friends, oh, that was the worst pain I ever felt. It can hurt. It can hurt. Lips are very sensitive. So here in our office, we use a very nice, strong, compounded numbing cream. And we leave that on the lips for a while before we start. then we use these distraction techniques that I think are fantastic. And I just did some lips a little bit ago, and this sweet gal said, I honestly hardly feel this right now. This is fantastic. She had a squeezy ball.
That's a huge compliment.
Yeah. She did so great. She had a squeezy ball in one hand. She had a little vibrating tool up along her jaw, and she just laid there, and we just literally breezed right through it. It was a cinch.
Oh, that's good.
So, leading up to it, I think it's important to avoid red wine for a day or two, avoid aspirin and ibuprofen, fish oil for a couple days. That minimizes your chance of bruising. Maybe take some Tylenol before you come in the office. And let us know if you're afraid, if you're worried about pain, then, we're going to do everything we can to make you as comfortable as possible. And in most cases, I think, at least for me, doing lips is a pretty quick process. If you can sit really still and just tough through it for, 10 minutes, we're done and you're good to go. The discomfort is typically just from the needle pokes. Afterwards, the lips can be tender when the numbing wears off. But the pain typically stops the second the needle pokes stop.
So that's reassuring.
Yeah.
I would say, that numbing cream that you guys have compounded is the best, because it's really amazing. It's a game changer.
Yeah,
it really
is.
And,
it is.
Having my lips done way back in the day when it was collagen, there was no pain or numbing cream. There was no lidocaine in the syringe. It was just like you had to just go for it. And I would kind of every couple of years I would do it again because it was too much. But now, we have, with the lidocaine that's in there.
I was going to say, that's a good point as well. Fillers now all have lidocaine mixed in. It's rare to find a filler that doesn't have lidocaine mixed in it anymore. So not only do we have that topical numbing cream, but we also have lidocaine mixed in the filler. So the way I approach lips is I kind of do a little here and a little here and a little here and a little here. And I try to get that lidocaine into the lip first. And then I try to get it in there. And I think that helps make the process much more comfortable as well.
Okay. The next new beauty winner is one of our favorite products. And it's something that not everybody knows about. It's a collagen stimulating filler, or a biostimulator, and it's called Sculptra. And so tell us about, it's kind of in a category on its own. It's not a hyaluronic acid filler. It's different. It's been around for a long time and favored by a lot of experienced injectors. So tell us a little bit about it and how people can think about it and where it would be used.
Right. So Sculptra, like you said, is a biostimulator. The whole goal of Sculptra is to build collagen. So it's a tiny little particle that we mix in sterile water and inject into the skin. And the goal there is that we're placing it in areas that need volume. Then once that gets into the skin, it enacts or encourages a inflammatory response. And through that inflammation, we get the body's natural process. Everything's going to swoop in and encourage that collagen to grow. And that's part of the natural healing process that occurs in our body. And when it's a very specific location, then you get that volume to grow where you want it to grow. And obviously it has to be injected into the right plane of the skin, into the right location, and slowly over about 6 months, you're getting collagen to grow. It's a multi-step process. We typically will inject patients about every 4 to 8 weeks. Every injector is a little bit different there. Sometimes it's a little sooner. Sometimes we wait a little bit longer. Again, just depends on where we're putting it and what kind of goal we're trying to achieve. But it's multi-steps to get the best result possible. That's really the most important part. But I adore collagen, yes. But when it comes from Sculptra, typically in my last couple 5-6 years, I get it toward the back of my face so that it holds my skin all up in place where it belongs.
Okay, so you're kind of pointing to like maybe the jaw, the back by your ears.
Jaws and right in front of my ears. Yes, yeah. And the goal there is to just hold the skin up, put it where it belongs so that it's not sliding forward. So, yeah.
It's like always that famous artist and everything's melting.
Melting. Yes.
So yeah, we just want to keep the skin.
Avoid melting.
Yeah. Keep the skin suspended.
Exactly.
And is there a certain kind of patient who might be a good Sculptra candidate? Is it certain age or certain issues with their face? Or what do you kind of think about who could benefit from Sculptra?
Yeah. I typically envision a thinner patient who benefits really nicely from Sculptra, or patients who have hollowing, especially this area under the cheekbone when that area is hollowing, or if we need even to add a little definition into the jaw, the temples. You can actually use Sculptra in other places of the body as well. I'm sure a lot of patients have heard that it can be added into the buttocks to get some lift and volume and projection, perhaps. So thinner patients who maybe just don't have a lot of fat, or who have aged in a way that that area is becoming kind of hollow and kind of empty, and we need to build that skin back up. It's great for improving the skin quality as well as adding volume. It's great for lines. We can use it in most parts of the face, but by, typically adding it to the cheeks or that area and the lower cheek, we can also improve the nasal labial lines, which are those parentheses that go around the mouth. So there's a lot of different things we can do with it, but in most cases, it's someone who just needs volume replacement in larger areas and wants it in the most natural way possible.
Yeah, I think that's the thing about it is nobody's going to know you had something done. It's
true.
Slow build and over time. And I think that's also great for men because men, a lot of times women will like tell each other whatever we've done. We don't care.
Sure.
But guys sometimes keep it a secret. And it seems like this would be something that would be good for them as well.
Yeah, I completely agree. It's, everyone's a little bit different, but tackling this when you're maybe 40-ish and up is a nice way to kind of think about these products, because you can maintain the collagen or the volume that you're losing sooner and, really prevent a lot of that skin laxity from occurring. So that's the best way to think about it. I think, obviously we can get to a point where, there is maybe too much laxity and Sculptra is not going to do what we want it to do. But starting early and trying to stay on top of that and just gradually replacing that as time goes is what I like to do with Sculptra.
All right. So the final filler award on our list today is in the category of best filler for hand rejuvenation.
Right.
And this is something that I don't know if people think about. We all think about our face and our neck and our chest a lot of times comes in as a, like afterthought, but like, oh yeah, if my face looks great and my chest doesn't, that's an issue. But your hands can give away your age.
Absolutely.
And so well, let's first of all say who the winner is. So what is the winner?
Yes, it's Radiesse. And Radiesse has been around for a long time. It was one of the fillers, the very first fillers that I started working with when I started injecting back in 2009. So then it was only used for face. It didn't have the hand indication yet. But later on, that came along as a really nice product to add into the back of the hands. I know for the people that can't see me, I'm pointing at those areas that are in between our tendons, where they kind of become hollowed out with time.
You see more of your veins.
Veins, yes.
It's like there's no more cushion around it, right?
Exactly, and that's exactly what it is. Our skin just loses that fatty tissue sometimes, that collagen, that elastin that keeps our skin really nice and tight and does kind of add that cushion. That goes away as we age. And so putting a little bit of Radiesse into the back of the hands is really pretty. So yeah, it's something that I've done for a lot of years now, and I really like the results. Sometimes we mix it with a little bit of laser treatment to the back of the hands. If we've got some brown spots that we can laser off, that's an easy procedure too. And we can definitely make the hands look more youthful.
Now, let me ask you on, with the hands in Radiesse, how long would it last? Because I know we all move our hands a lot, but I guess we don't move the back of our hand.
Yeah.
But how long does it hang out there?
Yeah. Usually a good year is pretty common. Sometimes, again, people can get it to last a little bit long, or people will notice that it lasts a little bit longer than a year. But in most cases, that's pretty typical. My patients over the years have usually just come in on a yearly basis once we've got the hands to a place that they're really satisfied with the look of them. Then maintaining it on a yearly basis is really common.
Okay, and last but not least, and you wouldn't believe this one unless you've tried it. And I've tried it, and I forgot to actually use it today because I'm usually pretty good about using this on days I do podcasts, because I have like a droopy eye. I have one eye that's more lazy or droopy than the other. And so there's an eye drop called Upneeq, and it won, I don't know if it was for, I'm not sure what the category they won for.
Remember.
Maybe
I don't remember the category either. Maybe.
But what it's for,
in-office procedure, I think.
It's sort of it opens your eye up more. And what I found is, of course I didn't do it today, of all the days that I forget, but it really does open my eyes up better. It's like a little automatic eye lift. Yeah. It's a drop. You pop it in, you drop it in your eyes. It starts to work within like 15 minutes, and then it stays all day. It works all day. So have you tried it yet?
I have. And I agree with you.
What you think.
I agree with you. I love it. I also have, it's my left eye that is just a little bit droopier on the eyelid than my right eye. And I have loved this drop. I was kind of slow to jump on the Upneeq train. That's the name of the medicine. I don't know if we've mentioned it yet or not.
I think we did, but Upneeq.
Okay.
Upneeq.
Right.
Upneeq.
So yeah, I started using it maybe 4 months ago. And I agree. It's kind of miraculous. It not only lifts the upper eyelid a little bit. I mean, we're not talking like, dramatic, but pretty, like not like surgery, but pretty. Just, it makes you look more refreshed. It makes you look less tired, kind of takes away a little bit of that puffy, tired look. It makes your eyes whiter. So you have a less red eye. Your eyes just look more alert. It's a very nice response. And like you said, you do it in the morning, 1 drop per eye, and you can have this great result for the entire day.
Yeah, and it like lifts the little muscle. It does something to make that muscle contract or something. Yep, so that's how it's like making your eye look more open and wide awake. Yes. And there's something psychological almost about it that it truly does make a difference on how you look, but it also makes you feel, at least for me, kind of wide awake. I don't know. Yeah. Just because I'm more wide awake when I use it, I don't know. But it really does work great. And it's, some people use it every day. They swear by it, do it every day. I use it just when I'm doing a podcast or if I'm going to an event. Like I know that I want my eyes to be even and normal. And it's not very expensive. So I think it's like maybe $4 or $5 per dropper, so
you can buy it in individual little packs. We sell it, I think 3 packs for $15.
Okay.
And in my experience, so 1 pack has 1 little ampule of the medication. I don't use the entire thing in a day. So I can typically get 2 days out of my little ampule.
I should try that because I'm always like using the whole thing and then my eyes are all watery later. And I'm like, was that because I used too much?
Probably too much.
Okay.
Yeah,
I love these little beauty secrets.
Yeah, you just need one drop per eye.
Okay.
And no, you don't need it to be, running out of your eyes. Then yes, you're wasting product. So
it's going
who
into
wants
my
to
ear
do that? Yeah. So yeah, one drop per eye. And like I said, I typically can get 2 days worth out of each ampule. So, those 3 little packets could last you a week, which is, fantastic for $15. Or you can buy a whole box. I think it's 45 packets that come in one box for $225, I think. So it's a little bit more, but I really think you can get a good 2 to 3 months out of that box. And like you said, if you're not using it every single day, which you really don't need to do unless you're, presenting or speaking publicly every day, or you're on TV, you would save it for the days that you need to look fabulous and refreshed. Or if you wake...
Oh, sorry. Go ahead.
No. Or I was just going to say, if you wake up kind of tired one morning, you didn't get enough sleep, it just really does make you look more refreshed, but it does kind of change your perspective, I think, so that you just feel more refreshed as well.
Yeah. And what I was going to say is I feel like we spend all this money on Botox, fillers, and, it's like kind of the perfect little companion to the Botox that you have around your eyes and your forehead. It's like a little instant eyelid lift. It's not the same as an eyelid lift, but it truly does make a nice difference. And a lot of us have one eye that's more open than the other. I think that's pretty normal. So just knowing that there's something there, and I love the fact that we sell it, you can buy just 3, not a whole box if you don't know if you like it yet or to try it.
Start slow.
Yeah, start slow. But now it's a prescription. Is that correct?
It is a prescription. So we do need to meet with our patients just once, or the very first time. We would like to at least touch base with you, lay eyes on you, whether it's with a virtual consultation or an in-person consultation in the office, just to make sure that you are a candidate for it. There are some health issues, of course, that we want to check on to make sure that you're healthy. Basically, we don't want you to have any eye issues, for instance, before we're prescribing an eye drop for you. It's just similar to Latisse. It's along the same line as Latisse, where it is a prescription. So we just need to meet with you before we sell that to you and prescribe it to you. So,
and honestly, I'm such a Latisse devotee. I think it's one of those things you can get your lashes done by somebody, but that takes a lot of time. And for me, I don't have the time.
And money.
And so I'll use and the money, but I mean, Latisse costs something, but if you're in Alley and getting all those points, you're getting points for Latisse that you purchase, or your Botox helps give you rebates on Latisse, or, it all works together. But for me, it's really nice because I don't have to think about it. I can put the little drop on my eyelid, my lash line every day or every third day, and just keep my lashes looking good. And as we age, it's like, what happened to those lashes that I used to have? Yeah. So that's another. As
hormones fluctuate, you're right. We lose the amount of eyelashes that we had at one point. Same with eyebrows, same way. Okay. So I have had some patients who've had good luck putting a little bit of Latisse on their eyebrows as well.
Interesting. All right. Well, that was fun. That wasn't it. I don't know how Latisse wasn't an award winner, because it should be.
I know it should be, and I know it has.
I'll give it my own award, right?
Yeah, for sure.
But so thanks everybody for listening in today on part 2 of our new beauty award winners, and thanks Jennifer for being with us and lending your expertise. I learned a lot today, and these are all really great products, and there's also a lot of other great products that aren't award winners that, might be better for you. And that's why you, like you mentioned, having that in-person consultation where you really discuss what are the goals? What do you have now? What do we have to work with? What are we trying to get to?
Right.
what's your budget, and we can, make all that happen. So check all the show notes. We'll have links to everything we talked about today, and then make sure that you listen for part 3. Part 3 of our new Beauty Award winners is where we're going to go into devices like lasers and other energy devices, and what devices won awards in this. And as a reminder, you can book online with Jennifer and all of our other wonderful providers if you go to our website at LJC'S.com or glamfam.com. Either one works, takes you to the same place. And if you look at the top of the website, it'll say book online, and you can book a treatment or a consultation with Jennifer or any of our providers.
Can I mention one more thing?
Oh, absolutely.
For new patients, we don't want to forget to mention that we have an amazing Botox special.
Right.
For our new patients, you can get 40 units of Botox for $290. And you are welcomed into our Glam Fam with a 1-year membership, which means you're going to get discounts on things like Upneeq and the fillers that we mentioned. So it's a great way to get established with our practice. We'd love to meet you. We'd love to give you some Botox, give you some Upneeq, some fillers, whatever it may be, whatever you like, whatever you need. Sculptra. There's so many options that we have. But
I'm glad you mentioned that, because and if you go on our website, we do have it on our specials page. So the 40 units for $290, it would normally be $580. So it's half price. And then getting the Glam Fam membership on top of it, that's a $120 value, because that's what it would normally cost you for that year. And then you get the discounts all year long. So that's a wonderful thing. Yeah, there's nothing wrong with saving money. I'm all for it. So anyway, thanks again, Jennifer, and we'll let you get back to your day and see your patients. And thanks for joining us. And everybody who's listening, thank you again. And stay tuned for part 3 of the new Beauty Award winners, where we'll talk about lasers and energy devices. So thanks, everybody.
Thank you, Monique.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to LJC'S.com or follow the team on Instagram at LJC'S. The La Jolla Cosmetic Podcast is a production of the Axis, TheAxis.io.